Okay, so I was thinking about questions that patients frequently ask. And one of the most challenging and I think interesting ones is the method by which potential patients or future patients are trying to make a decision which is very important to them, which is how do they pick the doctor that is right or the best doctor for them? And my answer to that question changes and evolves at all times. But I would say that my answer is probably quite different from ones that you read on the internet and as guidance. The first thing I would say is there is no one right doctor. There may be some wrong doctors, and hopefully they're very quick to tell. Maybe they have poor communication. Maybe they're not very personal or personable. Maybe they're aloof. Maybe they are egocentric. Perhaps they don't provide you enough of a basic discussion and description of what they're offering that makes it simple to understand. For me, those are the easy ones. I often say that there are very few people that are practicing within the realm of cosmetic surgery for very long that really shouldn't. The system of legality and the requirement of extremely high patient satisfaction results in patients communicating freely and often with anonymity on the internet about whether a doctor treated them properly. So if a person was really poor at what they are promoting, they probably wouldn't be in business very long. So that's a first thing is I think that the generation of fear or using fear as a tactic to guide people to someone is in my opinion, that's erroneous and it's sensationalist. In other words, I wouldn't go to them because they're not this or they're not that. I could tell you right now, there's no one in this region of the country with equivalent training and experience. Does that mean no one should go to anyone else but me? No, I don't think that's reasonable. Number one, I don't have probably the time to treat everyone that could possibly come to me. But it doesn't mean they're going to get a poor quality service or a bad outcome as a direct result of choosing another doctor. That would be misleading. What is important? A person has to have appropriate education, training, and experience. What should patients ask their doctors? I think listening and communicating, making sure and thinking of scenarios, hypotheticals. If I have a problem, is this doctor going to be caring? If I have a problem, is this doctor going to be available to me? If I have a problem, is this doctor going to blame me? Or is he going to say, well, there's a problem. Do we have to fix this? Or is this something I can easily help them through? Do I need to call on others? A doctor should never have hesitation to consider calling on another expert if it seems appropriate. Not a moment's hesitation, just as if it were a loved one. Okay, so being available, being friendly, being kind and considerate are important variables. Competence, what does that really mean? It means how many have they done and how often do they do them? If they do 100 tummy tucks a year, or 200, or 300, those are very powerful numbers that tell me a person is frequently involved in doing tummy tucks. Generally, that means that they have elevated their performance of the procedure to a very efficient means. They're doing it quickly. They're doing it not as a race, but to reduce the potential risk to patients. They are aware and competent as to research and what the evidence shows is the proper way to manage patients and their risks prior to surgery and after surgery. All of these things go into the wonderful milieu, the wonderful stew that is a good doctor-patient relationship. And you know what? That's important to talk about. The contribution of the patient, being a good patient, is part of the deal. I've had patients that don't listen to a word we say. I've had patients that don't follow directions, that can't follow directions. They're just unable to, as people, to follow specific orders and directions. That can be a bad scenario that can lead to increased risks and complications. But that's rare. That is rare indeed. It's mostly that if there is trouble, will my doctor be there for me, and will they take care of me, and will they not subject me to criticism, to negative comments, to accusatory behavior, and will they provide a service for me if there is problems that can amount to increased expense. All of these things are really important in taking good care of patients. This brings me to one other issue, is tourism. You can't have a very significant, long-lasting, and excellent relationship with somebody who's out of the country. You just can't do it. There's no way. The average person who comes in for a body lift procedure, which is a very common, large procedure for massive weight loss patients, the average number of visits to the doctor is 5.7 after surgery. Let me tell you, that's a lot of trips to the Dominican Republic or Mexico or Thailand. And for that reason and that reason alone, not because there's a poor quality service, not because there are droves of irresponsible and poor physicians, not at all. There are probably some excellent physicians that are well trained and skilled and experienced. It's just you don't have access to them when you go very far away. So I would always tell you that in the United States we have a wonderful legal system that presumes that people are innocent until guilty. But it also provides us a safety net that should there be issues that require compensation, there are many other countries that that system breaks down, or they have preventative measures that keep physicians from helping patients in case of need. So I think all those things really go into the decision of who is the right doctor for the patient, and I hope that helps.